Welcome everybody. Today we're going to be covering optic neuritis. So what is it? How do we get it? How do we treat it? And for any of those that are interested, at the end I will discuss my own journey with optic neuritis as my personal story. But for those of you not interested, you can just watch the first portion of the video to get all the information that you're going to need. So welcome to episode number 18 of Mind Over MS, produced by Energy Over Matter. Optic neuritis is a very painful and debilitating symptom that is commonly associated with MS, although it can be found in other infectious diseases as well as things like lupus or other autoimmune conditions. Most likely, though, we find it as one of the first symptoms in multiple sclerosis. So optic neuritis is really when you have inflammation of the optic nerve. And as a result of that inflammation, the myelin sheath surrounding it becomes impaired, which means the signal and transmission from your eye into the occipital lobe of your brain where it is processed is impaired. So this can manifest as just minor disturbances in your vision, maybe in one portion of your eye, the center, the peripheral vision, or it can be the complete eye. It generally attacks one eye at a time, but it can happen in both eyes at different times or repeat in the same eye during different relapses. Another thing that happens with optic neuritis sometimes is complete vision loss, or else you can just have disturbances in the acuity, your ability to see in fine detail, or also in the color saturation. So I like to call it Easter egg eyes. So going from where you see very saturated hues of really vibrant colors, all of a sudden everything looks like water paints painted on an eggshell during Easter, where it's very washed out. It has like a whiteness that's almost a film on top of it. So optic neuritis can also cause a lot of pain in the eye. So people that have it when they move their eye to look up, sideways, down, usually that vision loss is accompanied by pain as well. And the pain can actually be quite severe for some people. So optic neuritis, the conventional treatments they would give you if you were doing allopathic medicine is steroid treatment. That's not for everybody because there is a lot of side effects of steroid, and it doesn't actually change the outcome of the condition as far as your ability to recover from it, how long it takes to recover from it, and any resulting disability. All it really does is kind of stop the acute inflammation at the time of the attack, which I guess for some people that's a trade-off that you decide between yourself and whatever trusted doctor you have. The other thing that most people with MS are doing is taking some type of immune suppressing or modulating drug, which is the aim of these things is to over time to reduce disability, brain atrophy, and relapse rate. So again, not everybody's cup of tea to take these severe drugs that have a lot of interaction. I'm not saying one way or the other whether that's right for you, but and anyone that's following this channel knows that I do take a more natural, holistic approach where I like to look at things that would modify your lifestyle, your diet, and maybe get more at the root cause of what's triggering the inflammation to begin with, as opposed to just masking or suppressing the reaction. But with that in mind, you do whatever you feel is best for you because you're your own best doctor and your own best healer. So optic neuritis, then, once you're having an attack, I wouldn't actually in the acute phase recommend any of the exercises I'm about to show you due to the fact that we discussed that pain that might happen. This would cause a discomfort if you were trying to move your eye. But this is for somebody now that's in the phase of, so the optic neuritis has passed, you're trying to recover any function that might have been lost, or even the function has returned, but you just want to keep it sharpened and just kind of help with any regeneration or rejuvenation of the optic system. So this is going to be doing eye movements. Now I'm going to give you two different options. So one is what you would find mostly with like some kind of occupational therapy, functional therapy, physiotherapy, where they're going to be working not just on the optic nerve, but on the vestibular system. So I'm not going to go into great detail about the vestibular system in this episode because I'm going to cover it in another one where we're working on balance and proprioception on the whole. But I'll just give you enough of an introduction to just let you know that what it is the sensory information that's going to come into you from your vision, from movement, from your inner ear, that's going to tell you where you are in space. And when you have a congruent system and that's working together, then you feel balanced and you feel steady in your environment. But those of us that suffer with MS, or anyone even that just gets motion sickness, car sickness, seasickness, you'll know that as soon as there's an incongruent, so a not matching sense of movement to vision, that you can feel very sick. So anyone even just with car sickness will know this, that when you try to look down to read something, as soon as your body feels that you're in motion, but your eyes are not keeping up with the motion, you feel sick, which is why it helps in cars to look at the horizon. So this is the same thing when we spin on spinny rides, why we can feel sick. Same thing in the boat is because the horizon in our eyes almost stays in one place, but the boat is moving underneath us. With MS, you're going to see this now because it can affect many parts in your body. So it's not really like the vertigo you would see in other people where it's just really an inner ear problem. With MS, you're dealing now with the optic nerve, so our vision is impaired. You're now dealing with senses in our signals in our body, so our feeling, our temperature, where we are in space is compromised in parts of our brain from lesions or activity. So now all of a sudden, those places that are going to receive and transmit the information are going to struggle with it. So optic neuritis is not the entire story of the vestibular system, but it definitely is one part of it. So we're going to cover that today is just the optic neuritis. Functional exercise number 1 is going to be a count of 20, so 10 in each direction. And what you're going to be doing is keeping your eyes focused and fixed at one point in front of you. I find it actually helpful to do this in a mirror, so you might want to try that. And as you keep your eyes fixed in one place, you're going to turn bidirectionally. So first to the right, then to the left, and the whole time you're going to keep your eyes fixed in one spot in front of you. Now, you might notice if you've had optic neuritis in either one or both eyes and you've only partially recovered, you might notice that you have field of vision spots that are sort of blind or impaired. So I had never noticed this before for myself until I started doing this. And now I notice that on my right side, the peripheral vision is impaired. So I can now focus my attention and my energy there. So after we've done that in each side, 10 times, so a count of 20. We're going to do the same thing, but this time the plane of direction moves, but our eyes are going to stay fixed at that same point. So all we're going to do this time now is moving our chin up, chin down, up, down again, counting with our breath 20 times. Now, I suggest that you do this because honestly, it takes no time at all, multiple times a day. And because I believe in the power of manifestation and intention, I believe before you do this, you should be thinking about healing and you should be thinking about energy moving to this part of your body and restoring any of the function that you're struggling with, because the power of our mind is more amazing than most medications are. Okay, so after we've done these two functional things and we repeated them multiple times throughout the day, I'm going to next move into something that's a bit more on the energy side of things. You find it, this particular one I'm going to do today is more Qigong, but you can find a lot of these in yoga too. So I'm not going to be tedious by putting too many exercises in here because I think it's better to be concise and do a routine that you're going to follow. But if you're finding them really beneficial and you want to dive deeper into it, go ahead and just research what you can find other yoga exercises or Qigong. Both is going to be, again, pairing intention with energy flow. So in this one, what we're going to be doing is painting, using a paintbrush to draw circles with our eyes. So this is going to be now moving. The first way we do this, I actually want you to do it in a particular order. And this is actually based on the energy flows of the magnetic poles of your body. So I won't go into explaining all of that right now. just enough to tell you that you're going to be looking up and to your right side, and then down and to the left. And so that's the direction that you're going to start this first pattern in. And again, this one we're not going to do so much on a count and a pattern, as we're going to do it based on intuition and feeling. So when you look up, you're going to slowly move your eyes as far as they can see in your field, all the way around. And as your eyes are moving up in this pattern, what I want you to be noticing is, are there any spots where the vision doesn't see as well? And if that is the case, I want you to stop there for a moment and then move back and forth a few times. And think about it like you actually are painting with a black water brush. And you're getting a spot where maybe the brush, the paint is a little thin now, and you're going to go back over a few strokes to darken up the circle you're painting. So I want you to think energetically of almost doing that, where you're putting the energy back and forth into whatever spot maybe you didn't see quite as clear. And after you've filled in those spots, try again in one larger circle and see if this time all of a sudden, just with the intention and the thought of your energy, of all of a sudden that pattern and consistency and congruency has paired up a little bit better. Now, after we've done it to the right side, this is removing energy blocks energetically, in case anybody's wondering why we're doing it this way. I'll cover other videos about polarity and magnetism. I don't want to bore you with it here, but next we're going to be doing the opposite now. So now we're going to be looking to the left. And when you're looking to the left, this is putting energy back into the system. So what I'm wanting to do in this way is that any negativity we're taking out, but before we're done, we're putting the energy back into the system, which means you're going to strengthen your eyes in the end. They're going to have extra flow. So now you're just going to repeat the same thing. So you're going to be starting looking up, and then you're going to move to the left, and you're going to slowly move your eyes around, again, stopping anywhere where there's a little bit of a pause, a gap, somewhere where you found it hard to move smoothly. And then you just paint over that a few times. And again, intuition on this one. So you're following a natural breathing pattern, remembering to keep the breath flowing as you're moving, and thinking about the energy and where you're placing it within your body. I gave you the functional ones in the beginning because I know for some of you, the energy work might be a little out there. I assume if you're watching my channel, though, Energy Over Matter, that you are on board with the fact that our energy is as important as the matter or the physicalness of our body. In this case too, I want you to think about when you're sleeping at night, or when you're ever have your eyes closed or you have a moment, try to visualize energy in your body moving to your optic nerve. And then I want you to, whatever makes sense for you. What's worked for me in the past is having a vision almost of like a light ribbon wrapping around the optic nerve. And I visualize it in my mind and seeing this energy, whether you want to think the energy is flowing in from your breath and your crown chakra above you, however you want to see that energy being available in your body, you're watching it slowly wind around the optic nerve, recoding the myelin, giving energy for rejuvenation and for regeneration. Because anybody that has, again, I don't try those eye exercises in an acute flare-up because they're going to be painful. Wait till you're done with the actual active relapse. And this is now in case you find yourself in a position where you haven't recovered fully. Now you're taking the time to go back. Anyone that is struggling with MS or other autoimmune conditions knows that they've done some way to give us these powerful drugs to try to dampen our immune response, but there's not really much about restoring lost function. Now, I have been told, and I'm not sure what you guys have been by neurologists. I think I'll take this time now to get into my own story, because I know for some people, they actually like to hear personal anecdotes and other people's experience, because it gives some comfort for you, especially if this is new to you and you're not really sure what to expect. So I guess I'll back that up then and start at the beginning. So optic neuritis was not my first symptom, although for a lot of people it is the first symptom. And for those lucky people, sometimes it's the only symptom and it never comes back and they never go on to develop MS. And that's amazing if that is the case. And they do say sometimes, I've read, that if optic neuritis is your first symptom, that generally you actually have a better outcourse of your disease. For whatever reason that is, I'm not sure. But for me, anyway, it was not that. It was during pregnancy with my second son that I was feeling, all of a sudden I could feel my clothes on my body, which is a very weird thing to describe to somebody, especially when you've never felt it. But those of you that have numbness in your body, you understand what I mean, that all of a sudden for the first time, I could notice my pants because I could feel the difference between the part that was rubbing on my skin and the part that wasn't. Where in the past, when you have normal sensation, you just take it for granted, that sensation, because it's just normal. It happens every day of your life. And then I had the Hermits, where when you tilt your chin down, I would get that electrical sensation. Now, this was during pregnancy for me and during an acute stress response. I was grieving still for my first son who had just passed away. So I think the doctors just wrote it off as anxiety or depression or just some kind of like manifesting a physical symptom from my mental issues I was having. Which honestly, there is some truth to that, even though I did find it very insulting at the time. So anyway, those come and go, and they're resolved by the time my son is born now, and I think that everything's fine. And then that's when I get the optic neuritis. And the first time it comes in my right eye, and it's only partial vision loss, but it's really disturbing because I didn't know I had MS. And so all of a sudden, just to lose your eye is disconcerting. So I went to, it's very hard to get, at least in Canada, appointments with doctors and specialists, but optometrists, because we pay for them, it's easier to get an appointment. So I went to see the eye doctor. As soon as she put the light in my eye, they could tell from the optic nerve was pale, and that's a sign of optic neuritis. She looked in my eye and she said to me, have you ever thought or heard about MS? Now, I had been trying to diagnose my own symptoms, and I know that's not a good thing to do because Google tells us all we have brain tumors and we're dying. But I had looked at MS and I had thought about a lot of the symptoms, not just even that first time in pregnancy, but all the way along the way that added up to MS. So I had thought about it. So as soon as she said it to me, it made sense. And I was like, okay, I got to go, I guess, make an appointment and wait to see a neurologist. It took 18 months for that to happen. And during that time, I didn't get any steroids. And I probably would have taken them at that point because I didn't know what I know now about allopathic medicine. But they didn't offer it to me because I had a family doctor that didn't really know about MS either and wasn't really treating me. And I immediately, before I could even recover from the first optic neuritis, 3 months later, I got another attack, and this time completely black. So there was absolutely no vision at all. And I would say it took 3 to 6 months to gain the majority of what I would only get back. So it started with being like gray shapes and kind of shadows. And then it turned into, I could see like faces, and I couldn't, like if I closed my good eye, I couldn't read for sure. You would say it was legally blind, that eye. But I had some vision, and definitely with both eyes open, I was fine. I could drive, I could read, I was okay. And over time, I had some like Easter eggy color come back, and it stayed like that. It got better, like I said. But then I would say maybe I was at 70%, 60% restored vision, and then it just stalled out, and it had been years. And for those of you that have been told that once you have this kind of stall in recovery, that's actually disease progression now, and you're likely not going to recover any function, I'm going to tell you again, stop listening to the doctors. And if you have a doctor that tells you that you can't recover and that you can't get better, I think you should get a new doctor. Because even if the doctors know that placebo effect is half of the treatment. So if you're being told by somebody that you're stuck and you're not going to recover and you're never going to get better, that will be true. Right? If you believe it and they tell it to you, it becomes true. So I'm going to be a different voice for you. And I'm also going to be that anecdotal evidence that my eyesight has now gotten better. Now it stalled for a lot of years, but so did I. So I started taking the Copaxone, then Gilenya, then eventually Kesimpta, and thinking that I had this fate that they gave me and that there wasn't much to do. So I didn't change my diet that much. I had started meditating on and off, but I didn't quit smoking. I hadn't done things. And it wasn't until I actually made those decisions to modify my lifestyle and my mindset and really get serious about it that all of a sudden my vision did return better. Now I still struggle. Like I just said, there's a piece of vision missing there, and the color saturation is still not perfect, and the acuity too. Like if I closed the good eye, I couldn't read from there, but I can see eye contact now, and I can get on pretty good with that eye, and it still is getting better. And that's the thing. Even though it's been a lot of years, I'm gonna have to say now that's 15 years ago, those first two relapses. I never had another one in that eye. And the vision keeps getting better. So even though I'll still go through periods where I plateau for a long time, then there'll be a little improvement again, which makes me hold on hope that that eye can be fully restored still. The sad part for me is that in my major relapse 4 years ago, the worst one I've ever had, the optic neuritis came into my left eye. And it did recover actually pretty quick, and it's recovered miraculously. Like I can read again now. And if I, close a bad eye, that eye is pretty good. The color still, I would say, is not 100%, but that one I would say we're at 90%, which some of it also might just be that I'm in my 40s now and maybe I need glasses, which I haven't done. But hold on hope that these things can get better, and they will get better. And if you're in the place of pain right now too, the pain won't last forever. The relapse will settle down eventually. That pain goes away, and then work these exercises and use your mind to really put intention in there. And then I'll just leave you with that last little piece. I'll just reiterate it once again, is please, please don't just listen to the voices that tell you that you're stuck with this and it's permanent and it's just forever, because it is absolutely not true. If you don't just believe me, you can go through the internet and you can find all kinds of, not even just people like myself that do have some alternative medicine like yoga, PEMF. There are some things, the neuro-linguistic program I'm trained in. But look then, if you trust actually doctors, look at doctors like Terry Walls, or there's a lot of other doctors that are online, and you can find them on YouTube, that have MS themselves, and they are showing that there is recovery is possible. So don't limit yourself with a belief that you're stuck here and that this is how it is, because I believe that you can change. I believe that I can change. And we're all here collectively changing consciousness around these ideas. And I think that we know now that our brain cells do regrow, that there is neuroplasticity, that things are possible. And even if it's just not even in our own mind, we can at least look to allopathic medicine and technology, that there's so many amazing things that are going to come in the future, that if we just hold on hope and we do the best that we can, that maybe we will find miracles and healing for ourselves. So with that, I want you to have a blessed day and a blessed life. Namaste.